Followers in Weekend Warrior, today I would like to talk to you about the saphenous nerve. So why am I talking about that today? The saphenous nerve could be the source of pain in your knee or anywhere down your leg all the way down to your foot for various reasons. The saphenous nerve is a continuation of your femoral nerve. Your femoral nerve comes from your lower back, from your spinal cord in the lower back, and around your thigh it gives into several branches. One of these branch is the saphenous nerve. So one thing to understand is the saphenous nerve is a sensory nerve and it does not innervate any muscles. So if you have an injury to the saphenous nerve, you should not see really any particular weakness. But even without weakness, that could be the source of quite a bit of pain that could arise anywhere along the distribution of that nerve. So generally what triggers that pain could be a trauma, direct trauma to your knee, like a car accident or just playing soccer, being kicked in the knee, misstepping, you skip a step and you fall and you tweak your knee one way or the other. That could be starting an irritation of that nerve where it becomes inflamed and create some symptoms. The other common reason for your saphenous nerve to create pain is often with a knee surgery and generally a knee replacement. The branches of that nerve are very close to the surface, and when you have a pretty big surgery, they can easily be messed up with and sometimes cut in places, and that would be problematic for to regain all the sensation in your knee, as well as one of the main common, I think, reason for saphenous nerve entrapment is tight tissue. So for various reasons, you can have any muscles that can be tight that are running along the saphenous nerve that could be putting pressure. Generally, that pressure is in the adductor canal, which is right around here. You get your saphenous nerve running right through here. It's circled by muscles, and actually your saphenous nerve pierces through your gracilis and your sartorius. I have added some illustration to this video, so hopefully that will make more sense. So anywhere along here, if you have any compression, that can create that deep ache on the inside of your knee, as well as any discomfort and pain down generally your shin, and your saphenous nerve goes all the way through here, the top of your foot. So you could have pain and numbness, or also called paresthesia, all the way down there. So today I want to show you a somewhat easy way to stretch that saphenous nerve. If you have doubt that maybe you could be suffering from saphenous nerve injury, you have kind of had that pain on the inside of your knee, you've tried different things and that hasn't worked, that might be worth giving that a try. Otherwise, of course, this will not work for everybody, so please check in with your physio. They will be able to diagnose that as well. So if I wanted to stretch my right saphenous nerve, the best thing to do, so you're gonna be in this stance with the leg involved in the back. You're gonna turn your foot out like this. You could put this again a baseboard, that would work well, or get another furniture. I don't have that here, I won't do it. But the next step would be to tighten your quad, keeping your knees straight. And basically what you're gonna do, you're gonna go into a lunge. And you're gonna go back and forth like this. What you're gonna feel is, if you suffer from saphenous nerve entrapment and discomfort, you're gonna feel a stretch along the distribution here. And potentially, if you were going too far, you would feel pain. So you always wanna kind of stay within a small range at first, and then kind of test it, and then if you can tolerate more, you can go more. But you really don't want to go into pain with this, and you want to also keep your hip squared, just like that. And this is how you mobilize your saphenous nerve. If you want to go a little bit further up to where and reach the femoral nerve, what you could do is add a little bit more stretch by just lifting your arm there. You could also add a little bit of a head extension to get a little bit more stretch, but just in this direction, and make sure you don't feel pain. That's really the main precaution here. So try this out. You can comment, let me know how that worked, if that helped you. That would be great to hear. And otherwise, have a good day.